Welcome to Kubatana Together as One. As you know, Kubatana is a non-political, non-profitable organization. We exist to serve the poor in the society here in the UK, as well as back home in Zimbabwe. Today, we are privileged to have a guest in the room with us. He is a medical practitioner based in Zimbabwe. He's also the CEO of a medical aid society called Ultramed Healthcare. This has been in existence for about 4 years. Please help me to welcome Dr. Syd Mukonoweshuro. Dr. Mukonoweshuro, how are you?
I'm well. How are you, Yolita?
I'm all right, thank you. Thank you so much for being here with us. As you know, we are here in the Diaspora and we always welcome news of what's happening back home. I don't know if you are able to just give us briefly, what's been happening, how your work has been affected by this COVID-19.
Yes, that's fine. Well, thank you for having me. Well, for starters, nothing is as it was, and nothing is going to be as it was. So COVID-19 has changed the dynamics totally, because from the very beginning, we had to shut down even our practices because we didn't have the sort of protective equipment to be able to handle people in our private practices, so that had to shut down. But I must say, from the very beginning, Zimbabwe was quite proactive. We had what I think was the benefit of hindsight, because we had watched other countries go through it. So the moment the first case hit our shores, a total lockdown was effected. And I think that could be one of the reasons why our numbers are still quite low. We have moved in tandem mainly with South Africa, which is really the biggest country in the Southern African region, and which is really the gateway to the rest of the world. So South Africa has really been on the ball, and we have sort of just moved with that. So the security forces were deployed. You couldn't move around. So the first 3 weeks were total lockdown, what they call level 5 lockdown.
Oh, well. So how is it so now? You said your numbers are quite down, which is something we welcome. We are really pleased with that. How is it now? Do you think you're over it, or are you in the middle? Where are you exactly?
Yes, so it's a bit difficult to tell, but I suspect that we are probably nearing what could be the tail end of it, because most of our cases here in Africa, in fact, all cases in Africa were actually imports. So just from the logic of it says that if you could close your airports, which is what was done quite early, and you quarantine everyone who is coming in, that's what has happened. Everyone who is flown into the country has been put in a quarantine facility for 3 weeks. So I'm pretty sure we're nearing the tail end of it. The problem with pandemics of this nature, however, is what they call the second wave. When you loosen the lockdown restrictions and you let people move, if you don't have the sort of the correct adequate structures and instructions of social distancing, mask masking, then you can actually get a rebound of the condition, and that can be worse than the first. So what has now happened is our government has moved us to what they call level 2, where certain companies can sort of begin to open, but maintaining strict social distancing protocols. And what we have also adopted is what is called mask masking. So everyone has got to be wearing a mask.
Okay.
That really has been shown to prevent the spread of the virus, because if I have it, even as I talk to you, the aerosols coming from my mouth are going to be contained by the mask. So that's going to limit the spread, and then social distancing. So I think if we continue with the social distancing component of it, the mask masking bit, and also quarantining anyone who's coming in from outside the country, we may actually escape the storm.
Wow, that's very good news, because here they're only just talking of relaxing the lockdown. So you're talking of masks, masking. Where are you going to get these masks? Is it just any clothes, or do you have them in place already?
Yes, so commercial masks are great, but even where you don't have commercial masks, you can still use homemade ones. Because the thinking is that when people have a conversation, when we are talking, there is aerosols that are flying in the air that you can't see. And it is believed that those things may actually be one of the reasons, why the virus is spreading. So anything that acts as a barrier can actually work. So homemade masks can actually work as well. But the most important thing is to maintain social distancing. And that is not something that will need to happen for the next 3 weeks. That is something that may need to be in place for the next 3 years, which is why we then say that COVID-19 is going to change the way the economy is structured. It's going to change the way business is run. So in healthcare, we are really trying to beef up our telemedicine component. So a lot of our consultations now, we are asking people to call in first, describe the symptoms. If the symptoms are suggestive of COVID-19, then we sort of refer you to where you need to go first before you actually come into the rooms. If it's something that we can handle, that's non-infectious and non-contagious, then yes, you can come into the room. So telemedicine is going to be a big part of healthcare going forward.
Wow, so it's obviously affected the way you're going to work from now on. And how is it affecting the disadvantaged in the society? Because you're talking of phoning. Not everybody has got a phone. So how is that going to work? Where's the education? Are people being educated as to what to do?
Yes, it's very interesting you say that, because you might or might not know there is more cell phones than toothbrushes in Africa.
No, I didn't know that.
Yes, so don't be surprised. The people you call disadvantaged are actually holding 2-3 phones at a time. So in fact, from where we stand as a healthcare fund that has attempted to actually go into the bottom of the pyramid, we're excited because the only way you can provide access to healthcare to the very poor and the very vulnerable is telemedicine. Telemedicine is actually the only way that we can lower the cost of healthcare, because the doctor cannot charge the consultation he charges if you see him in person if it is telemedicine. So telemedicine will have to be cheaper because it's just a phone call. And that is what is actually going to lower the bar and allow more people access to healthcare. So we're pretty excited about the prospects of giving healthcare to people who previously couldn't access it. Because it's a phone call, I talk to you, because 80% of diagnosis is actually made through what we call history taking. So me just asking you questions, I can actually get 80% of the diagnosis. And then most 60% of conditions we actually treat don't actually need me to touch the patient.
True.
So you can actually describe what's going on, and we actually liaise with the pharmacy. You walk in there and collect your drugs. So we're very excited about that future, and we really want to lead in that.
Wow, that is very interesting, and sounds like it's a step in the right direction. Oh, I'm excited about it. What advice would you give us in the diaspora concerning our relatives back home? How can we help? What sort of advice would you give us?
Well, for starters, allow me to extend gratitude. What the diaspora has done for Africa as a whole, for Zimbabwe in particular, can never be thanked enough. Literally, we are surviving off your sacrifice. So every single Zimbabwean nurse or doctor who lost his life, they actually lost their life trying to keep us alive. If you actually see now the sort of lines that are there or queues that are actually there on Western Union or Mukuru, tells you a story that because of your sacrifice, we are actually able to survive. So I would like to, really be grateful for all that help, and just say, look, just continue supporting your relatives financially if possible. But we also appreciate the fact that you are probably, in the heart and the eye of a storm. We wish we knew how we could help you too.
Oh, thank you, Dr. Mukonoweshuro.
Yeah, so maybe the best we can do is to pray for you, that this thing flattens out where you are, and then we continue. But just continue with the support that you've always, given to your relatives back home. And we think that, once telemedicine is established, it will be quite easy for your relatives to access healthcare over their mobile phones.
Thank you. Thank you so much for being our guest, Dr. Mukonoweshuro. And allow me to say we really appreciate what you're doing back home, the education, and also your sacrifice, because staying back in Zimbabwe is a form of sacrifice. Not all of us should come over here. So with time, hopefully we can have you back to discuss further about this medical aid society, because that is the way forward for everybody to have medical aid, because not everybody will have cash at hand every time they are sick.
Definitely.
Yes.
Definitely.
So thank you
very much for having me.
Thank you. We'll see you. Thank you. Thank you so much, viewers, and keep a lookout on this page. We will have more guests, more information from back home, and we plan to make this informative as we possibly can, as well as fun. So take care, stay safe, and stay at home. Bye.